recommend any other protocols for those who are struggling with acid reflux?
Acupuncture. Since I'm an acupuncturist, I have treated many people with acid reflux pretty successfully. However, even before becoming a GAPS practitioner, I always would say it is due to your diet. It is due to what you're eating. I mean, sometimes there's some structural things. Yes, that's true. But for the most part, most everybody, they need to look at what they're eating. But acupuncture can also be helpful in that with everything. Acupuncture can be a great thing to go alongside as you speed up. Yeah. And help relieve maybe painful things, or also, I mean, even as a GAPS practitioner and as an acupuncturist, it's really not in our scope of practice to tell people to stop taking medication. But I do give them the little story about kind of the war, the battle that is happening when they take medication to stop acid from being produced. Then their body's like, but we need acid, so they start producing more. So it's this it's like this circle effect. So I won't go totally deep into that with them or you right now. I know, are an expert on that. I'm certain of it because of your history. But yeah, so that's what I would say.
So you would suggest okay, so tell me a little bit more. What does acupuncture do for those that you worked with acid reflux?
So the diagnosis for acid reflux in Chinese medicine is rebellious qi. It's funny because qi has a certain ways that is supposed to move in our body. So right here in our body, right here, the qi is supposed to be moving down. And if it's not, it's rebellious. So it can also be like belching or throwing up or whatever too. But acid reflux is kind of a upper, or it's a fire, like a heart or a fire, heat in the body can be that too, depending on, people have different symptoms with acid reflux. Sometimes it's burning, sometimes it's not, sometimes there's all kinds of things. But so I guess it would also depend on how they're presenting with acid reflux. I even have one woman who has been diagnosed with it by her doctor and is on medication for it, but has not had one sign or symptom ever of acid reflux.
Oh, okay.
So isn't that one interesting?
Yeah.
Anyway, I mean, I guess maybe damage still can be done, but I don't know. So yeah, so I mean, I'm not going to go deep into the whole Chinese medicine points and everything that I use. It's that was a master's degree. That was a long program, and I learned a whole lot about what to do for those things. But so yeah, you just do certain treatment protocols according to what the person is presenting with, and then trying to cool the body or move the qi the correct way.
And then you putting that together with the food can really help people find results and getting it resolved the way they want to.
Well, I believe the food will help them even more than the acupuncture with acid reflux. Absolutely. The GAPS diet, yes, will be much more helpful.